Hello everyone, we're going to talk now about the chief complaint. If you look in your notes with me, Principle 1, place all the patient complaints they need addressed in the chief complaint. And what we're talking about here is this. You remember in medical school, we were taught to put only the chief complaint. Well, it says chief complaint. But really what the auditors are looking for is, are we addressing what the patient is coming in for? If they come in with one thing, are they leaving with 5 different things that we're kind of coming up with? So really the purpose of the chief complaint is to put on there what is the patient there for. So if I go in the room and all I see on the paper or on the computer that the patient is coming in for, let's say, headaches. The nurses just put that. Alright, they got some information on headaches. After I address that with the patient says, actually doctor, I'm also here to address this rash. We talk about that, and then let's say right knee pain. Okay, well these were things that really the patient had in mind and needed addressed. So these need to be in the chief complaint. Alright, so that's principle 1, place all the patient complaints. All the patient complaints, they need addressed in the chief complaint. Principle 2, the chief complaint should be the foundation of the progress note. So here's the principle here that again, the insurance auditors are looking for a progress note that flows based on the chief complaint. So what is the patient coming in for, and then you sort of build on that. So under there it says anything in the chief complaint should be addressed in these 5 areas. Number 1, and that makes sense to all of us, HPI. Number 2, review of systems. Number 3 is physical exam. Number 4 is diagnosis or assessment. And number 5 is treatment. So I know this is intuitive, but a lot of time as we rush as clinicians, going from room to room, we may have some information in the chief complaint, and we may not have anything in the HPI, or it may, or a little bit, and then we may have some in the physical exam or whatnot. So we really gotta be careful that it all flows. Whatever is in the chief complaint, there's a description everywhere, and that makes sense, and it really should happen for medical documentation as well. Alrighty, and then the second bullet there is basically the reverse of that. Any presenting patient complaint addressed in the progress note should be in the chief complaint. For example, if there is something in the progress note body, in the HPI or the physical exam or whatnot, if it was a complaint, alright, that needs to be in the chief complaint. So whatever is in the chief complaint needs to be everywhere else. Whatever is everywhere else, if it's a patient complaint, needs to be up there. Alright, so obviously if the patient is there and we discover something, let's say we discover anemia, or we discover something that wasn't a complaint that they came in for, that wouldn't have to be in the chief complaint because they did not complain about that. Principle 3. The chief complaint is the list of the medical issues that the patient is presenting with, and not necessarily the patient's answer to the question, what brought you here? Alright, so here's what I mean by this. Again, what we're taught in school is when a person comes in and you say, what are you here for today? What can I do for you? Usually the answer a lot of times ends up in the chief complaint. Although this may be accurate, sometimes this is confusing, especially if the person getting the history is a person who's not going to follow up and do the rest of the progress note. So we have to list there not what the patient answer is to that question, what brought you here. But we really need to kind of dig in and really see, why are you truly here? Not just take that little kind of 1 word or 2 words. So here's an example of common bad chief complaints that we see. So the first one there is follow up. All right, do you guys see that? I see that all the time. I go in the room and all it says up there is follow-up. All right, so according to this rule, this is not a medical issue. All right, so the statement under there says even though the patient may be coming in for a follow-up, what should be placed in the chief complaint is what symptoms they are having that they are following up on. So, you know, in a way, you know, every visit most of the time is a follow-up on something. I could have seen them 2 months ago or 6 months ago or 8 months ago. So if I saw someone 8 months ago or 3 months ago about diabetes, and I tell them, okay, check your blood sugar, come back to check your diabetes, you know, we don't want to have on the chief complaint follow-up. We want to say diabetes. I mean, they're coming to discuss diabetes, and that's what the insurance company want to see. Meaning, what is the patient coming in to discuss? All right, not what did the patient say when we asked them, "What are you here?" and they say follow up. Okay, that's not good enough. All right. Here's another one that is fairly common: is medication refills. Don't you see that a lot? All right, medication refills, and the statement under there says, since every time we refill a medication, we review the status of the disease the medication is for, the chief complaint should be that disease. So for example, if a patient comes in and says, I need a refill on ADHD, well, obviously we're not going to just refill the medication. We are going to discuss his status on the ADHD. We may have to adjust the dose, we may have to go up or down, we may have to change things, we may have to review the diagnosis. Even though the patient says, I am here for that, what they're really here for, the medical issue that they're here for is ADHD would be in this case, all right, and not medication refill. So let's not put that there. Number 3 would be the word consultation, and these are just some examples that I've seen. Again, consultation is not good enough. We have to say consultation for what? All right, what is the medical issue? What is the complaint? So remember, on principle 3, the chief complaint should have medical issues, and now we're talking from an insurance standpoint. If you want to put other things, that's fine, but that's not going to count toward you know, getting credit from an insurance standpoint. All right, so principle 1, principle 2, and principle 3, basically pretty straightforward. Let's put in the chief complaint everything the patient is coming in for, and let's make sure that the rest of the progress notes reflects what's in the chief complaint. Thank you very much.